Hi, I'm Dr. Neil Schultz, and welcome to Viewer Question Week at both BeautyRx and Derm TV. Today is the August 2013 edition of BeautyRx Live, where over a live streaming video, I can do this, where over live streaming video, I'm going to answer your questions about BeautyRx skincare products, the same award-winning and patient-proven skin products that have been giving my patients more beautiful skin for over a decade, and not just more beautiful skin, but younger looking and healthier looking skin. And they really do this based on the principles of improving color and texture, which are timeless issues that concern the skin from the time you're a teenager until you're in your 80s. So without further ado, if you have any questions, please go to BeautyRxLive.com, type your question in the text box, and I will answer as many questions today as I can. So again, this is the August edition, 2013 of BeautyRx Live. I'm Dr. Neil Schultz, and I'm going to take the first question right now. This is from Sammy. And he asks, can sand rub off sunscreen, like when you're lying out on the beach? Sammy, that's a very interesting question. Anything that touches your face, whether it's your hands, or wind, or water, mist, and sand, certainly can help remove your sunscreen. So if it's sand or any of these other factors, you're not going to get the same amount of protection from your sunscreen, which is all the more reason why, again, you need to reapply sunscreen every 2 to 3 hours if none of those things are going on, and certainly every time after you swim, after you sweat, or after a lot of sand has blown onto your skin. We have a question from Chris. I'm a male in my mid-20s with combination, let's get that back on the screen, with combination type 4 skin who has had acne for the past few years. It's primarily closed comedones on the forehead and some blackheads on the nose. I get an occasional pus pimple or papule on my forehead or around my nose, which I have left alone and they've cleared spontaneously. I want to start treating my skin to get rid of the lingering acne. I do not use anything right now except Dove soap in the shower. And by the way, Chris, Dove soap, which is a very mild soap, that can be a problem on acne-prone skin, and all acne-prone skin by definition has too much oil, and Dove has oil in it, number one, and number two, doesn't remove enough of your oil, so certainly that's not the cleanser we would recommend for acne-prone skin. With BeautyRx skincare products, we usually recommend balancing cleanser, which has enough surfactants in it to help remove the oils that you need to remove. Chris mentions that he's purchased an over-the-counter acne wash with 2% salicylic acid for twice daily use, which is much better, Chris, and a leave-on 10% glycolic product for night use. Many of the over-the-counter toners contain 2% salicylic acid. Is it overkill to use a toner with salicylic acid along with these other products? No, it's not, Chris, because the toner is not a leave-on product. The toner is going to evaporate and it's only going to really have limited contact. So just like a cleanser with glycolic or a cleanser with salicylic, which is, again, not a leave-on product, you're going to get very limited contact time with those exfoliants. So I'm not too concerned about that as long as you're not having any irritation. Also, the toners tend to continue to contain around 40% alcohol. Is this too much, and should I opt for alcohol-free instead? No, Chris, I think as the last part of this question, what I would suggest is you look for something between 5 and 10%. I think 40% alcohol is much too strong, and I'm afraid that's going to strip your skin. Let's go on to a question from Ellen. She understands that skin brighteners lighten pigmented and darker skin, but can they also be used in a preventative fashion? If so, which type should I use for prevention? Ellen, that's an interesting question because it depends again on the active ingredient. Hydroquinone will help to prevent additional darkening since it will tie up the tyrosinase enzyme, which is so important in creating the different chemicals in the steps to making hyperpigmentation. So you could use hydroquinone to help prevent hyperpigmentation. But my question to you is, where would you use it? So I'm not sure. It depends on what type of darkening of the skin you're talking about. If you're talking about from having picked an acne cyst or just having a really bad acne cyst, would it make sense to put some hydroquinone on that after the skin healed? I guess that it would if you're somebody who's prone to darkening. If you're talking about preventing tanning from a day out at the beach, I don't think it's going to be very effective to put hydroquinone on for a day. So I would frankly restrict my bleaches, whether they're hydroquinone based or whether they're peptide based like the BeautyRx brightening complex. I think I would restrict them to times when you're actually treating existing darkening. Theoretically, they could help to prevent secondary hyperpigmentation, but I would need to have a more specific question than what you've asked. But thanks very much. Again, I'm Dr. Neil Schultz, and this is BeautyRx Live. We're over live streaming video. I'm answering your questions about BeautyRx skincare products and related skincare issues. If you have a question, go to BeautyRxLive.com. Put your question in the text box, and I'm going to answer as many of them today as I can. We have a question from a guest, and it says, "Hello, Dr. Schultz," and that's all it says. So I'm going to say, guest, hello to you, and I hope you have a real nice day, and I hope you enjoy the rest of the summer. Then Nora has a question. What are the best vitamin supplements for skin and hair, and how effective is omega-3? Well, Nora, I assume when you say omega-3, I assume you're talking about orally, not as opposed to putting it on the skin. And omega-3 can be helpful for your skin in the right doses, but the problem is to get high enough doses from natural sources. You almost have to swim with all the fish that you're eating, because to eat enough of that fish, I think you're going to grow fins, and that might not be attractive. So the real problem to me on the omegas is getting enough of them from natural sources and from dietary supplements. I don't think there are any studies that really demonstrate how much you have to take, which is the problem. In terms of vitamins and other supplements for your skin and hair, if you're eating a normal, well-balanced diet, I'm not sure that you need to take supplements. And if you're not eating a normal, well-balanced diet, then what is it that's preventing you from doing that? And a one-a-day multiple vitamin with some minerals would be helpful, but there are so many, quote, anti-aging supplements, and so many of them do not have proven track records that I'm a little reluctant at this point to recommend specific ones for you, and instead would recommend a heck of a lot of sunscreen with frequent use, because I think that is the single most important thing you can do to prevent premature aging of your skin and to keep your skin in the best condition. Second most important thing, of course, is daily exfoliation, and third most important thing are topical antioxidants as opposed to oral antioxidants, because the oral antioxidants, just like other supplements, it's very hard to get a sufficient concentration to the skin by taking them orally. You've got to take so much. The beauty of skin with these products is that you do have a second window of opportunity to get them into your skin, and that is to apply them topically. So if you're going to use that third most important product, a topical antioxidant, make sure it's a vitamin C based antioxidant. I think they work the best. In particular, vitamin C products that contain the active ingredient of either methylsilyl ascorbate or tetrahexadecyl ascorbate, and make sure you're using your antioxidants at bedtime so they have time to seep and into and penetrate into the skin, so they're on station inside the skin cells the next day when you're out in the sun, to help prevent against that sun damage, which, despite the use of adequate sunscreen, that sun and UV rays just manages to get around and through that sunscreen. Great question, long answer. Let's just go back up. And Rachel asks, do you really trust the water-resistant ratings on sunscreens? It doesn't pass my gut test that you can apply sunscreen, go swimming, and still have the sunscreen remain intact. Rachel, gut impressions are so important. We used to have different ratings on sunscreens, and with the new monograph rules, you can only have water resistance for either 40 minutes or 80 minutes. and nothing beyond that. So we no longer see those misleading ads for waterproof, because to your point, you put a 7-year-old in a pool with sunscreen on his arm, and you let him splash around for 20 minutes or a half an hour, and it's very unlikely that after all of that repeated elution by the water that's coming on the arm and off the arm each time it's splashing, there's not going to be much sunscreen left there. So I'm glad that we've gotten rid of waterproof. On water resistant, actually, they've done tests, and those tests consistently must demonstrate persistence of enough sunscreen to pass the test to demonstrate the SPF that the product is rated for at that amount of time. So despite the fact that your gut tells you one thing, this is a situation where, do we listen to what the FDA testers tell us? And I'm inclined to listen to them. So the product says it's water resistant for 40 minutes. Then despite splashing and this, that, and the other thing, if it's an SPF 30, you can be sure that after all that splashing, after 40 minutes, they took that person out of the pool and they tested the affected area of the skin where the sunscreen was applied, and that SPF was still intact. And the same thing for 80 minutes. And the reason they stop at 80 minutes is because your gut and my gut tells us, as do the FDA tests, that you're just not going to be able to ensure adequate protection after 80 minutes. Again, I'm Dr. Neil Schultz. This is August, BeautyRx live streaming video answering your questions about BeautyRx skincare products or related skincare issues. If you have a question, just go right to BeautyRx live, look in the chat box, send in your question, and I'll get to it as soon as I can. Mark asks, I enjoy the tan I get each summer and understand a tan means damage. Perfect, Mark. Anytime your skin gets darker, it's been damaged. But once I get it, how can I maintain it? Or at least avoid having it disappear quicker than normal? Will shaving my face cause it to fade quicker than if I didn't shave? Mark, you probably know, if you've been watching Derm TV and know about BeautyRx skincare, that I am one of the most passionate people about the value and importance of exfoliants, because exfoliants remove the excess dead cells that cause skin to become dull, matte, as well as excess skin cells that can actually clog pores. Well, when you get a tan, your tan really involves a lot of layers of skin with the melanocytes, your pigment-forming cells, in response to the injury from the dangerous UV. In response to that injury, those melanocytes made more pigment, pushed it up into the upper layers of skin, into many layers of skin, layer over layer with more pigment, and that's what causes the browning of your skin and your tan. Well, I just got through telling you how important exfoliation is for helping remove dead cells and make your skin smooth. If you want to keep your tan, you should stop exfoliating. So if you're using a chemical exfoliant like glycolic, you would stop using it, and therefore you would have a slower rate of loss of the cells that have the extra pigment that give you your tan. Your skin will become a little more matte and dull as a result of accumulating uneven mounds and piles of dead cells, but you'll keep your tan longer. And coming and circling back to the last part of your question, shaving. Well, shaving is a form of physical exfoliation, and as a matter of fact, the reason that most men's skin looks better than women's skin in our 30s and 40s and 50s is because we've been mechanically or physically exfoliating with a razor every time we shave, and that probably has been since the age of 12 or 13. So shaving is a form of physical exfoliation which will help remove the dead cells faster, make your skin look better, but make your tan fade faster. So if you don't shave, your tan will last longer. But if you don't shave, you're going to grow a beard, and nobody's going to see your tan anyway. So that's a little bit of a catch-22, but to your point, cessation of exfoliation is the best way to prolong your tan. We have another question from Chris, who says, for sun damage in the form of freckles, should hydroquinone be spread across the entire area of skin where the freckles are, or only on the freckles themselves? I love this question. The reason I love it is because hydroquinone is a good bleach, but not a smart bleach. And when I say it's not a smart bleach, I mean it will lighten the pigment any place you put it. So if you have a dark freckle here and a dark freckle there, and in between you have normal lighter skin, when you put hydroquinone on the whole area, it's going to lighten the freckle, but it's also going to lighten the already normal skin in between. So the freckle will get lighter, your normal skin will get lighter, and you will maintain the contrast, the relative contrast between the freckle and the lighter skin. So because hydroquinone bleaches everything, you need to be very discreet when you're using it and put it only on the freckles, not on the normal skin. That's as opposed to a, quote, smart bleach like Brightening Complex, which is one of the BeautyRx skincare products, which is a bleach that is peptide-based, and those peptides, those botanical peptides, only affect darkened skin. So you can put Brightening Complex all over your whole face. You don't have to worry about dotting out the individual freckles, and you do not lighten the lighter area. You only lighten the freckles, and it's just much easier. And Chris had a second part to that question. I feel like the only way to apply only to the freckles would be using a toothpick since they are small. Chris, you're absolutely correct. A toothpick or a Q-tip. So depending on which bleach you're going to use will determine how long it's going to take you and how specific and accurate you need to be when applying your bleach. Lily asks, what are your thoughts on the use of moisturizers during the summer? Are they necessary? Lily, we use moisturizers for two different reasons. One is to help combat dry skin, and the other is to help reduce the appearance of fine lines and wrinkles, because the moisturizers, by adding moisture to the skin, help fluff up the skin a little bit, and that helps to smooth out temporarily fine lines and wrinkles and smooth the skin out. So if you have fine lines and wrinkles, it doesn't matter what season we're talking about. Yes, it's appropriate to use a moisturizer in the summertime, although, of course, there's more humidity in the air in the summer, so you may find that it works a lot better. In terms of dry skin, if your skin is dry in the summer, then use a moisturizer. Usually facial skin, when it's dry in the cheeks, not in the T-zone. If your skin is dry, which means you either see flakes or feel that your skin is tight, particularly after washing, then use a moisturizer. So again, it depends. Are you dry? If you're dry, use it. If you're not dry, don't use it in the summer. And if you have fine lines and wrinkles, regardless of the season, you can use it. So I'm going to ask you to, if you have any additional questions, why don't you go to BeautyRx Live now and put your final questions in, because we're going to be running out of time soon, and I'll be taking the last question or two very shortly. Georgia asks, hi doctor, what product should I use to treat a sunburn, a really red one? Georgia, believe it or not, old-fashioned aspirin is very, very helpful for the discomfort of a sunburn, and putting on compresses of equal parts of skim milk and water is very soothing. It helps take the fire out of the sunburn, it helps make it fade faster, and it helps, the protein in the milk is a wonderful chemical buffer, and it helps restore the skin to its normal pH, which has been altered by the sunburn and the damage. So milk and water compresses for 5 or 10 minutes, 4 times a day. After the compress, why don't you try putting on some aloe or a moisturizer or even an over-the-counter hydrocortisone. That will also be helpful. And obviously avoid additional sun, but if you're going to be outside, you've got to use a sunscreen. So milk and water compresses, moisturizer, aloe, or hydrocortisone cream, and lots of sunscreen, but even better yet, this is a time, one of the few times that I ever professionally tell people best not to go in the sun. Because normally I never tell people not to go in the sun. I just tell them how to protect their skin in the sun. But if you're already damaged, I think you should be out of the sun. So this is going to be our last question for this session. And this question is from Molly. And she said, I purchased your exfoliating green tea complex, which I love. However, can I use it in combination with another exfoliant at night, or is that all the exfoliation I'm supposed to do during the day? Molly, actually, it is perfectly fine to use the exfoliating green tea, which has 10% glycolic, with an SPF of 20. It's perfectly fine to use that in the morning, and at the same time to be using either the starter strength exfoliants of 8% serum or cream, or the daily exfoliating therapy cream or daily exfoliating therapy serum, depending on your oil and water skin type, or the 10% advanced exfoliating therapy pads or even if you've advanced up to the 15% products of creams and gels. So by all means, we'd love to get this synergy between all of these different exfoliants to keep your skin smooth, glowing, lustrous, and healthy. So we do have time for one more question, and I'm going to take a question from, I think it's Zan, Z-A-Y-N. And Zan says, hey, Dr. Neal, my acne is now under control. Good for you. Will a chemical peel and using tretinoin cream or 0.1 or 0.5 help fade my acne scars and my dark spots? I'm very happy that your acne is under control. The tretinoin will not help acne scars. Scars or raised bumps or depressions from old cysts. Sometimes people get scars confused with stains. So you said my dark spots. Dark spots will be helped with any exfoliant, whether it's tretinoin or whether it's glycolic or salicylic acid. But the tretinoin 0.5 is a very strong tretinoin, very easy to get irritated. What happens if your skin gets irritated from tretinoin or anything else? It gets inflamed and then it turns darker. So for somebody who's trying to reduce dark spots from prior inflammation from your acne, you really want to be careful and make sure that you don't cause any inflammation, additional inflammation, by using too strong of an exfoliant. So I would say if you're going to use tretinoin, use the 0.025 or the 0.05. Not even the 0.1 that you're mentioning. And if we're talking about red spots after acne, only time is going to help those. A little bit of over-the-counter cortisone may help them temporarily. You don't want to use any tretinoin or any exfoliant on red spots. It can't help them. It can only make them worse because, again, that's part of the healing process. So I want to thank you for all of your great questions. Thanks for tuning in to the August edition of BeautyRx Live, and I'm Dr. Neal Schultz. We'll see you tomorrow for Derm TV, where we will continue Viewer Question Week and take viewer questions from both YouTube viewers and DermTV.com viewers. Until then, if I don't see you tomorrow, then enjoy the rest of your summer, and I'll see you in September for BeautyRx Live. I'm Dr. Neal Schultz, and thanks for tuning in.